Karen was diagnosed 4 months ago with early stage breast cancer. And then we have Robert Harrison, who's with us here. And Robert was diagnosed 14 years ago. He is not a cancer survivor, but a cancer thriver, which is how he labels himself, and we want to make more of Robert. He comes from the perspective of having metastatic prostate cancer right from diagnosis onward. So 2 very different patient perspectives. Karen is not able to be here. Her oncologist advised her not to travel. So she prepared her video that we're going to listen to. And as we listen to her video, she does reference being in a study as helping her tremendously. And but she does bring up some very important points of being in that study as far as self-monitoring opportunities, what kept her on course, that she does bring to this audience here. However, I want to reiterate, we cannot rely on studies to get patients the care that they need. We need to provide physical activity and weight management as a part of standard of care. And that's where we're going with this workshop. But again, her points are very well taken. And I think now, Cindy, you want to play the video?
Hi, my name is Karen Cochrane, and I was diagnosed with stage 1 breast cancer in October. I had a lumpectomy in November, and I'm currently receiving chemo, which is why I'm not with you guys today. But I'm so excited to tell you some of the things I've learned about obtaining a healthy weight and being physically active through this journey, and I know beyond. I'm 53 years old. I am a strong Christian. I'm a wife. I'm a mother of 2 teenagers. I am a nurse. I work at Children's of Alabama, and I'm very active with my community, with my church. Oh, and I'm a Crimson Tide fan. Roll Tide. And congratulations to Clemson. No, really. I want you to know I'm just a normal, regular person who was diagnosed with breast cancer in October. One of the things that I was asked is, what was my experience? So I was very fortunate to participate in a study before my lumpectomy to help me lose weight and to be physically active, and that was very, very helpful to me because it set the tone to continue as I've received treatment. Some of the major challenges that I faced, especially through the cancer, I feel great. I really, really do. If they didn't tell me I had cancer, I wouldn't know it. But when I received the chemo, that changed a little bit because I have a really yucky taste in my mouth, which is very, very common. So it's changed my appetite. Some days I've had to force myself to eat. Never thought I'd see those days. And other days I just want to eat anything. So being able to set the tone and think really hard about just eating a healthy diet every day, regardless of how I feel or the circumstances, has been very, very helpful to me. And being physically active has also been very helpful. If nothing else, it makes me feel good about myself to know that I've walked for 30 or 40 minutes. But I also see changes in how I look, how my clothes fit. So I have been doing that even on the days when I don't really feel that great. You'll notice I'm referring to my notes because I don't want to miss any important points. I know chemo brain is a real phenomenon, but hopefully I'm not there yet. But just in case, one of the questions I was asked to address was, did I have the information and tools that I needed? And I can say absolutely yes. I was provided really good information with the study about making healthy food choices and not just one particular food, but what I needed for a well-rounded diet and to be physically active and to look at my heart rate when I was exercising. I met with the breast health care team to talk about my diagnosis and my plan of care, and that included a surgeon, a radiation oncologist, a medical oncologist. And that very first day, the radiation oncologist suggested doing the study and talked about my weight and said to me, remember, the #1 killer of women is heart disease. So as I'm working to get to a healthy weight and being physically active, this isn't just about surviving the treatment for cancer. It's for making sure that I do everything I can to live a long, healthy life, not just for cancer, but for my overall well-being. The next one was, did you receive support from the clinicians caring for you? And absolutely, positively along every step of the journey. And I think it's really important to know that they initiated the conversations. I did not. They talked to me about how important it was for me to have a healthy weight and to be physically active. And that was going to help me through the treatment, but again, for my healthy, long life. Next question. What programs, tools, and resources were available to you to help you achieve and maintain a healthy weight and lifestyle? So I wear the Fitbit every single day, and I've had my Fitbit for a long time. My employer has a wellness program, and so I've always tracked my steps. I like the active minutes, but now I'm also tracking my heart rate, and I have an ARIA scale that shows my weight, it syncs to my Fitbit, and I'm also using my FitnessPal that I write down every single thing I eat. And it tracks with the scale and it tracks with the Fitbit, so they sync together and give me really good information every single day. I really can't say enough about the MyFitnessPal, and that doesn't have to be the only app that's out there. But when you look at what you eat, it makes a big difference. And it shows you how much protein, but how much salt, how much fat, and you can make really good choices based on what you're seeing. I even use it to plan my meals. So if I'm going out to dinner, I may even log what I plan to eat for dinner and then plan my whole day around that. That's been extremely, extremely helpful to me and has helped me to be successful. I don't think I mentioned that since my diagnosis, I've lost 22 pounds. So that's very excellent. I'm very proud of myself. And, some days are better than others, but that's real life. So I'm making good choices based on real life. With my pre-chemo education, I was given a booklet with information about nutrition while receiving chemo. That booklet has been very helpful to me. It's very well written. It is easy to read, easy to follow, and such a useful tool. As I've mentioned before, when you have something that you can refer back to, especially if there's a side effect that you are experiencing with the chemo, then you can refer back to what that specific side effect is and some things that you can do. Another thing, and this is so important, my experience has been that when you tell people that you have cancer, many are very quick to provide unsolicited advice about what you can eat to cure your cancer. I've heard tons and tons of information. Some of it's really good and some of it's accurate, but some of it not so much. So I would recommend to any healthcare provider that they address that with their patients to begin with, to say, you're going to hear some things, you're going to read some things, please talk to us before you begin any diet, before you take any supplement, before you take any probiotic or anything else. Let's talk about what works and what doesn't. That needs to be addressed from the very, very beginning. And again, I haven't asked for a lot of advice, but I've gotten a lot of advice. So that's important to know. The last question is, what recommendation do you have for healthcare providers, hospital administrators, and/or payers to improve the delivery of weight management and physical activity interventions to cancer survivors? I'm a nurse. I actually write patient education, and so I see a lot of information. I knew before my cancer diagnosis that obesity actually leads to cancer many times. So it wasn't the knowledge. I had that. But what has helped me is to have a plan and to have follow-up. So it's not just one conversation. It isn't enough to say to somebody, you need to lose weight. People need to be told how to lose weight. They need to be followed up. There needs to be somebody there to ask silly questions. Am I eating enough? Is this the right amount? I don't feel good. My hip hurts. What can I do? It needs to be a long-standing program and support. And truthfully, if we would provide programs for people, proactive programs before they're ever diagnosed with cancer or heart disease or knees that hurt. It would be most helpful and dollars better spent to provide programs and support to teach people how to make healthy food choices and how to become physically active. It isn't easy, because if it were, we would all be normal weights and very, very active. But with help and support, it can be done. It's not just providing some written information or saying you need to lose weight, but it needs to be an ongoing, really lifelong process. Thank you so much for giving me this opportunity. I appreciate it.